which was on Sunday. And for the most part, we see about, if you look at the graphs, somewhere between about 50 to 80 new cases a day in Palm Beach County. It was a peak, 170 on Sunday. If we look at the deaths here locally in Palm Beach County, today it's 224 deaths have been reported. That's up about 35 cases or so since a week ago, and is actually 10 cases since yesterday, additional deaths. That doesn't necessarily mean that all happened today, because sometimes it takes a few days for the data to get through. But the point is, there's still, I think, a lot of activity going on in terms of new cases, in terms of deaths reported. One of the reasons we're probably seeing more cases, or continuing to see more cases, because testing has become more prevalent. There's more testing available, so we're seeing more cases. And depending on how you calculate it, you might say that the percentages of positive for the state, for the county, have declined a little bit, but it depends what data you look at. I think at best they've probably plateaued or begin to come down just a little bit. Now, if we look at models, the latest model from the group out at the University of Washington, the IHME, is now predicting that in the state of Florida, by the end of August, we're going to have 4,000 deaths, with the possibility of somewhere between 2 and 11,000, allowing for error. And that 4,000 figure is actually more than double from last week, before a lot of the stay-at-home orders were lifted here in Florida. So those are statistics generated by these groups. I'll tell you, today I was on a phone call. I serve on the ethics committee for the JFK Medical Center. And JFK, one of the major hospitals here in the county, right now as we speak, there's approximately 50 patients in the hospital who are diagnosed with COVID. There's about 10 to 12 who are in the ICU. And the statistics are that about 13 to 15% of everyone who's admitted to the hospital with a COVID diagnosis will die. So that's still going on. And I don't think those numbers, to my knowledge, have changed very much over the last 3 or 4 weeks. Because at that juncture, I think I heard it was about the same thing, about 50 with about 10 to 12 in the ICU. Fortunately, because of a lot of advanced planning and social distancing, a lot of responsible people, we've avoided what was an anticipated surge, and we haven't overstrained our local health facilities. So that's very fortunate. Now, I've been reading excerpts from a book, trying to read parts of the book called Viruses, Plagues, and History. I think it's the second or third edition I'm reading, which was written in 2010. And they talk about the interaction between politics, culture, and science. And they say when these issues clash, unfortunately, science usually loses. And a quote from that book, Viruses, Plague, and History, says, when culture or politics confronts science, culture and politics most often trumps until a disaster occurs. And that verb, interestingly, was written back in 2010 when we had a different president. But for what it's worth, I think we see a lot of that going on, and there's a lot of balancing acts that people are trying to make. We don't want public health disasters, but on the other hand, we don't want to see economic disasters. We don't want to see emotional mental health disasters. So these are all part of a balancing act. And I mention that because I think that came into play yesterday at a county commission meeting here in Palm Beach. I wasn't at the meeting, but I've read a number of articles and excerpts today about the meeting. And the commissioners met and apparently agreed to send a letter to the governor asking him to put Palm Beach County into what they call the phase 1 reopening, like the remainder of the state, kind of saying that we shouldn't be categorized with Broward and with Miami-Dade. They cited some numbers. I mean, you can make statistics say anything you want. The numbers that I saw is they said that we have per 100,000 people approximately 226 cases. Broward has 280. Miami has 479. The state has 174. So to me, that's pretty close to Broward. Looking at deaths per 100,000, the commissioners cited that Palm Beach has about 14 deaths per 100,000. Miami has 14.7, Broward has 11, state of Florida 6.9. So I don't know exactly where all that data is extrapolated to, but as far as I can see, there still is some question about what's going on. an interesting comment that was quoted in a number of sources. Vice Mayor Robert Weinroth, he said we need to lift some of these restrictions quicker, comparing the COVID situation to chickenpox. He said when he was a child, he was forced by his mother to play with friends to intentionally contract the disease. So what's the big deal? I don't know. I think we could have a discussion about what the big deal is. I don't think COVID and chickenpox are exactly on the same level in terms of the death rate, in terms of other things. He also went on to say that 100% of us here in Palm Beach County are sacrificing for essentially the 20% who are really vulnerable. I guess referring to older people with comorbidities, but the data I think is showing that anybody can be susceptible to this disease. And what I've noticed in discussing this with colleagues, medical colleagues, and friends of mine completely out of the medical profession, a person's views changes very much when somebody who's a friend or family member suddenly gets very sick or suddenly dies from this problem. Two friends in particular, one guy who actually runs a pawn shop, he sent me an article yesterday. I had a good friend of his who's a mutual friend who died a week ago from COVID. Wasn't that old a guy? And my friend, who tends to be a little bit more business leaning, should we say ultra right wing type of guy, his views are changing when somebody like that died. Another friend of mine who is a hairstylist, who is a bit upset that those restrictions haven't been lifted yet, and perhaps some modification needs to be made there. But his views have also changed dramatically. One very good friend of his, who was his high school football coach, apparently, something like 30 years ago, he's right now in the hospital on a ventilator. So, when it touches home, suddenly it's a little different perspective. So it's tricky. But I will say at yesterday's meeting, my esteemed colleague, Dr. Alonso, who runs the health department, had some really important advice, and I'll quote her. Responding to the vice mayor, she said, "You are correct that we are making a sacrifice. Everybody is making a sacrifice for not having a large loss of life and not overburdening our healthcare providers." She went on to say that we have flattened the curve here in Palm Beach County because we put in the social distancing right when it could have been bad. This is not a matter of ripping the Band-Aid off and everything will be fine, because then the cases will go back up. And when we talk about the younger population, that 80% who shouldn't have to worry because only 20% are affected, they're the population that walking around largely asymptomatic and may very well be spreading disease. So just a little bit of the local politics and the challenge in balancing culture, politics, and science. Now, if we take a look at what's going on in terms of just that comment about how it's only 20% of the population, it's just an article that came out today, or the last couple of days, up in New York, both in the city and in the state. They have reported greater than 50 children who've shown up now with mysterious syndrome possibly linked to COVID. It appears like almost like a toxic shock syndrome. They have inflammation of their blood vessels. None of the children who've had this very severe outbreak have died, but a number of them, children and teenagers who have been on ventilators. And similar syndromes been seen in Europe. So to say that it's only certain people getting this, I think is a little premature. Also speaking in New York, they were hit very heavy with surges that they were not able to be prepared for. And they've gotten things much better under control. We're seeing that the deaths per day are declining. But if you look at the figures across the United States, it's more of a plateau. Now, if you take off all the New York state figures out of the equation, you actually see an upswing in cases across the US. Statistically, showing greater than 20,000 new cases a day, over 1,000 people dying across the country. And interestingly enough, we've seen in the last week or so that a lot of rural areas that were up to now totally unaffected are suddenly popping up on the map. They're just something to take under consideration. The New York Times reported that there was an internal administrative report that came out today from the president's administration predicting that there would be about 200,000 daily cases in the US by the end of next month. quite a surge with up to 3,000 daily deaths. So it's just numbers all over the place. I think, to me, this just reiterates the uncertainty that we always talk about here. So what other things are going on in the world of COVID? Well, we read how on the federal level, Dr. Rick Bright, who had been part of the BARDA commission and was fired, he's now filed a whistleblower complaint with the Office of Special Counsel. He's the guy who warned against importing Plaquenil from Pakistan and India. Plaquenil is the antimalarial drug, which was the favorite drug a few weeks ago. Now, actually, there's enough studies showing that this probably is not anything that's going to be helpful, might even be hurtful. And I'll tell you another thing on our meeting today at the Ethics Committee of JFK. Plaquenil had been on the list of FDA-approved drugs and was part of what they called the order set for COVID patients, meaning you could check off if you want that for your patients once they're admitted. That's now been taken off the order set. So the feeling on Plaquenil, it's probably not really the way to go. New one that's been in the news a lot since the last week or two, which we mentioned last time, remdesivir. This is what they call nucleotide analog. It was developed for Ebola, but not shown to be effective. Study came out last week. Wasn't really a study. It was just kind of some preliminary data, but it showed that the recovery time for the very sick patients was reduced from 15 days to 11 days. Somewhat significant. The death rate went from 11.5% down to 8%. So I don't know if that's hugely significant, but the FDA did approve it for emergency use, and I know it's available for the doctors who want to prescribe it over at the JFK hospital. Stem cell therapy has been in the news lately. Stem cells, people trying that for everything with some very controversial mixed results. I think it works for some conditions. Now you've got guys promoting it for COVID. Stay tuned. We'll see where that goes. The other thing that's been out there a lot, now we've been talking about contact tracing. As we move forward and lifting some of these restrictions, to do things responsibly, we're going to need to increase the testing, and then it's going to be tied in with what they call contact tracing, which is to find out who has been exposed and who they've been exposed to. One of the challenges is in finding contact tracers to make this whole methodology work. The state of Florida apparently has 500 of them through the Department of Health, but experts say we need somewhere around 5,000 to 7,000 to be effective here in Florida. So hopefully that will happen. I can tell you the Medical Society here in Palm Beach County is working closely with the Department of Health. We're told that first that's going to go through their epidemiological staff, and then additional personnel who come through what we call the MRC, Medical Reserve Corps, which is a project coordinated through Medical Society Services. So anyone who's interested can call the Medical Society and sign up with the what we call MRC to be on the volunteer list. I think that's something we're going to be seeing more of. The antibody testing, also an important part of figuring out who has been exposed to it. Remember, the antibody testing is not the cure-all for everything. It's going to just show who has been exposed, and just because you have antibodies doesn't mean that you're immune to getting it a second time, but it's going to be a good, important epidemiological tool. Florida is going to start doing that at hospitals and drive-through sites, and it's going to be a much simpler test than the one that's been done on the PCR. The CDC on Sunday released a study. They talked about the fact that we have limited data on how long somebody will shed the virus, which means after you've had the disease, at what point are you not contagious anymore? The recommendation until a few days ago was to be in isolation from 7 days. CDC now says it should be 10 days. Isolate for 10 days after the illness first appears, the first symptoms, and you need to be isolated 3 additional days after recovery, which would be resolution of fever and the other symptoms. Otherwise, a couple other quick things here. On the good news, Pfizer, along with a company called BioNTech out of Germany, has announced that they're beginning to test a COVID vaccine in the United States on humans. They started testing in Germany last month, and they are looking at what they call messenger RNA particles. They're starting the testing up in New York at NYU, also University of Maryland. There'll be some other sites. So that's very good news. There was also another vaccine being tested by a company called Moderna, working with the NIH. They started testing in March, and Johnson & Johnson has a vaccine in development. So they are expecting to do some human trials starting by September. And I just got off of an interesting webinar with Scripps, who has a facility here in Palm Beach County. And they're a nonprofit research organization doing incredible amount of work worldwide. And I heard them talking for an hour about the development of what they're looking to come up with as either treatment and or vaccine technology for COVID, and particularly looking at treatment, because vaccine, is a way to immunize people so they will have a resistance to the disease. But besides that, we'd like to have a way to treat the problem, to treat the virus. And interesting project that Scripps is doing, they have a special name for this called Reframe. And what they're doing is they're looking at lots of existing medications, including the remdesivir, including the Plaquenil, and a number of other medicines, and they're testing them globally to see if various combinations of these drugs might actually work. So, the good news is there's a lot of extremely smart people working 24/7 on this. So hopefully we'll have some good news as the weeks go by. Other than that, I'll just give a couple quick things here. Beef and pork processing down 40% because a lot of the factories have been closed because of the clusters of cases. Fresh meat sales are up 22%, and Impossible Burgers, if you like them, they're now going to be in like 10 times as many supermarkets as they were before. And the Peloton $2,000 exercise bike that people may be familiar with, and now that people are staying at home and looking for things to do, including exercise, they report that their stock is up 86% since mid-March. So good news for that company, good news for the people getting the exercise on the bikes. That brings us up to date there. Any questions?
And good news for anyone who invested in that stock when this first started.
Yes.
So Brent, before I unmute everyone, you've hit all of the questions that I had prepared. So
read your mind.
Collaborated, but you didn't attack one of the rumors, and I just wanted to hopefully validate or at least talk about this rumor that there's possibly a new strain circulating that is more severe and more invasive than what we think of when we say coronavirus, and that there's no immunity factor even if you had the previous version.
That's a great question. And that's actually one of the topics I skipped over for time's sake. But you're referring to, there's some research that comes out of the Los Alamos National Lab, okay? And they discovered a new mutated form of the COVID strain. It was detected actually back in February in Europe. And just as you said, it's more infectious than the previous strain. The good news is it's not more lethal, okay? And the fact that we are aware of it, folks who are working on developing treatment and vaccines can take this into consideration. And the good news, again, hearing these brilliant scientists on the call that I just got off of with Scripps, they're fully aware of this, and that's why they're looking at combinations of medications or combinations within vaccines so that people wouldn't develop resistance to even these stronger strains. So the scientists are on top of this. You just have to be patient.
And one question in the chat room is, the numbers that you cited are cases that were tested and tested positive, and not including people who are diagnosed as presumed positive, but with symptoms, but have not been tested yet, correct?
Yeah, those cases are the people who were tested by primarily through the traditional PCR testing, is what they call that. So when you're presumed positive, you're not considered positive yet. So then you're a person under investigation, right? PUI. Okay, so you don't get counted on the case list until a positive result is confirmed by the laboratory.
I have a quick question.
Sure.
Yes, I saw somebody post on Facebook the other day, which is kind of dangerous, I know, to watch what they're saying, but they said that children do not pass this disease on to adults. Has that been proven statistically, or is that just someone's, anecdotal look?
Yeah. I would say that we don't have really great evidence one way or the other. And until proven otherwise, we have to assume that children certainly can pass this on. Just like, when you have young kids, I remember when my sons were little boys and like in preschool, and, they'd come home with these colds and things, and they'd be sick for like one day, and I'd be sick for 2 weeks. And I think there's a lot of differences in our immune response of younger people as opposed to people who are a little bit more mature or older people. And there's no reason to think like why you wouldn't catch it. And I think with the advent now of more antibody testing, we'll be able to find out who's had it and who's developed antibodies. And primarily that information is going to show us who's actually been exposed to the virus. So then we'll be able to work the data backwards and find out if there were people in families who say, I don't know who I could have caught it from. And they find out when the kids had it, that's probably where they caught it from. So I think that's what the data is probably going to show.
Thanks.
But be careful with those Facebook stories. I think there's some good stuff there, but then you have to go verify it and see if that was really written by a reputable source.
Brent, this is Karen. I am concerned about what's happened at the commission level. There were no health care representatives involved in the designing of this plan. Is the medical society thinking of making sure it gets onto some of these task force? And the other thing I'm concerned about is it's very thorough in terms of the types of businesses they want to open, but it doesn't address the support system that needs to be in place. If you don't have childcare open, you don't get your employees to go to work, you don't have a place for the kids to go after school, the libraries and the community centers where usually those older kids go are closed, and they really are not designed to continue social distancing. So I think this is a very confused proposal that they passed yesterday.
Yeah, I would agree with you on that. We haven't met yet at the medical society level to see what we can do. We work very carefully and very closely with Dr. Alonso in the health department. So we will extend to her the offer that anything we can do to make this right will be part of that. And her comments, which I mentioned before, which I think were very, very responsible. And she's been making extremely responsible comments all the way through this crisis.
The other thing I'd like to add, yesterday I was on a conference call with Speaker Pelosi, and she's really looking for input from small business employers, asking what their employees need to get back to work.
Yeah, I think coordinating all that is important because, again, we can't stay closed forever. Okay, as we said, there are economic disasters, and you have to balance that out with the potential public health disasters. So there's got to be some type of middle ground, but it is concerning, as you referenced, when you don't have healthcare people at the table voting on the issues. Even the governor's task force for this, there's one healthcare person on there, as far as I can determine. He's the CEO of a hospital system. So I'm not sure that is the best person to be getting all of your healthcare advice from.
Well, and they need some insurance people on there because this is going to have a dramatic impact on health insurance rates.
No question about that.
And so, Brent, I'm going to have to cut the questions off here now because, honestly, this a very informative medical briefing, and it actually took longer than I had timed it out. So I'm now having to do a little toe tapping to get through the bios of our two guest speakers, because we have for you folks two guest speakers with credentials a mile long each. So I'm going to have to try to condense some of their qualifications just to introduce them. But joining Brent and I tonight are Kimberly Spire O and Matthew Dietz. Kimberly is an attorney in private practice who received her JD degree from Hofstra School of Law and a BS, a Bachelor of Science. I don't want to leave the BS in there for the folks with the huge imaginations. In Industrial and Labor Relations from Cornell. Her practice focuses on special education law and advocacy and disability law representing clients throughout Florida. Kimberly is also a frequent speaker on special education issues for most of the state and many state and national conferences. And her qualifications just go on and on and on, very highly qualified. And I mean, no disrespect by cutting it off right there, but I want to make sure that folks have time to hear you and Matthew talk. Matthew, I don't know, I'm really going to have to truncate your lifetime experiences in getting you to this moment. But Matthew is a founding member and current litigation director of Disability Independence Group. He's been practicing in the arena of civil rights litigation since 1996 and has handled hundreds of matters involving the Americans with Disabilities Act, the Fair Housing Act, and other civil rights laws regarding the rights of persons with disabilities and others seeking equal rights under the law on the basis of race, color, national origin, gender, age, familial status, sexual orientation, and gender identity. Matthew received his Juris Doctorate from Brooklyn Law School after receiving his Bachelor of Science in Business Administration from Boston University School of Management. Kimberly, Matt, welcome. You're unmuted.
Okay, can you hear me?
Yes, and so are you, Matt.
Yep.
Great, great. So who's going first?
I'm going to just quickly introduce, I'm the one
So, Kimberly, you're going in and out. You're intermittent. I don't know if it's your internet connection or your microphone.
that might be. Is it better now?
It's still intermittent. Ooh.
Then I'm going to have Matt speak and I will try calling it.
Do you have the phone numbers with the meeting ID that you can call in on?
I can get that.
Okay, good, good. Thank you.
Okay, can you hear me?
Yes,
Okay, am I loud and clear?
loud and clear, Matt. Thank you.
Perfect. For the past month, I've been working on the disability issues involved in the COVID crisis. And most of these are local issues. The big difference with disability rights in dealing with a pandemic like COVID and a hurricane is that usually for a hurricane, there's hurricane programs and there's sign-up sheets and there's shelter sheets and people are told to get their medication in advance, and there's a whole set of programs that set around persons with disabilities. For this crisis, there was not. So when folks were planning for this crisis, they did not take into account the needs of persons that have disabilities. One of the there's two issues that have come up, main issues, three actually. One of them deals with testing. The other one deals with prioritization of care and bioethics, which is an extreme hot issue now. And the third one is food insecurity and transportation. The main issue that I saw locally was the testing issues. 35% of the persons who have died in Florida of COVID have been folks in long-term care facilities. 60% of the people are over 65. A huge majority of those are persons that have disabilities. Now, when the state first opened the testing for folks with disabilities and partnered with local health districts or or counties, they started drive-through testing. Drive-through testing, by virtue of it being a drive-through testing, excludes folks in long-term care facilities, excludes folks that don't have transportation. So one of the first things that I've tried to do is try to get an at-home version. So if you're homebound, you could call up the county and say, I can't get to the drive-through facility. Now paratransit is essentially broken down in some parts of the state because paratransit only provides transportation for folks with dialysis or chemotherapy. So a lot of paratransit drivers aren't even showing up. So there's no ways for these folks that don't otherwise have transportation to get to where they need to go. After working with Disability Rights Florida, we sent letters to Miami-Dade and Broward, and Miami-Dade agreed immediately to provide the service because you have to under the ADA. You provide a program or service, the service has to be provided in a non-discriminatory fashion. So Miami-Dade immediately agreed. Broward, it took some pushing, but as of today, they have started doing at-home testing. Palm Beach has not. Palm Beach has decided that it was only going to provide testing starting last week to those who have previously registered for disability services in a shelter. So as compared to Miami-Dade and Broward, Palm Beach is definitely lagging behind and not regarding the lives of its folks that have disabilities that are homebound. The same issue is currently occurring with group homes and long-term care facilities, and the governor has ordered testing with the National Guard in long-term care facilities, but still, even though many long-term care facilities have programs, are permitted to do testing themselves with separate labs, a lot of them have not. Part of the issue is the difficulty in isolating persons with COVID in long-term care facilities and the spread of COVID in long-term care facilities. So it's a huge problem and a huge issue. And on Friday, the CDC issued new guidance recommending priority to testing in long-term care facilities. The state of Florida has not adopted that and has not mandated testing in long-term care facilities. So it's a huge problem, and so far, because of the Miami Herald's reporting and questioning, we know more about deaths in long-term care facilities and infections in long-term care facilities, but we still don't know the amount of infections or deaths in group homes or in intermediate care facilities for folks with developmental disabilities. So the next thing that we're planning is to propose an emergency rule to APD and to ACA to require testing for healthcare workers and patients of long-term care facilities if a COVID infection is found, and if possible, evacuation to a hospital. Part of the spread is due to healthcare workers going from patient to patient in these facilities and the lack of adequate PPEs. So there's a huge problem and disproportionate amount of deaths in long-term care facilities and with home health care services. With regards to bioethics issues, when this first started, there was a huge issue with the bioethicists saying that there's going to be a shortage of ventilators. And if there's a shortage of ventilators, those ventilators should go to folks that have the most life years left, which automatically disqualified folks that were elderly, folks that had serious disabilities, or folks that had specific disabilities, such as CP, minor dementia, and other disabilities. So we objected to the Florida Bioethics Network's standards on prioritizing the use of ventilators. They're trying to redefine the standard into making less weight on disabilities or life years. But so far, the state of Florida has not accepted those standards, and and hopefully they're going to become moot with more availability of ventilators. My concern is that if we allow rules to be enacted that prioritize one life over another, it makes life more worthless, devalued. On top of that, the Florida Hospital Association has recommended to the governor to have qualified immunity for injuries or deaths as a result of COVID-19. Excuse me. That can't be done without legislative authorization. The problem we have with that is if long-term care facilities choose not to test their residents, they're more likely that they're going to die of the virus. If home health care agencies don't test their employees, there's more of a risk of spreading. Part of this is to incentivize long-term care facilities and home health care facilities to test their staff, to ensure that they do use best practices so people don't die. And by increasing immunity, gives a disincentive to take more preventative measures and doing more tests. I can't understand how communities like Fisher Island, Ball Harbor, and Coral Gables can buy tests for their residents, yet we can't do it for long-term care facilities. So I tried to be as quick as possible to give Kimberly some time to speak and to allow time for some questions. Thank you. And if Kimberly knew sign language, it would work so much better. We can't hear you.
That's really bizarre. Let's see.
So while Kimberly tries to get on, there's one other additional issue that we see with persons with disabilities is condominium rules that seek to not allow visitors in. I just filed a preliminary injunction last week because the condominium association had a rule that no visitors were allowed in. So they excluded a woman's home health aide, and they refused to allow her in. So we had to file a preliminary injunction to say that is an accommodation for a person with disabilities. The same issues also occur with things like valet parking. So if a person with a disability has if a person with a disability has an issue where they usually valet park and the car is parked far away, that person could ask for an accommodation to have the car parked closer to them.
Okay, she's there.
Oh, can we hear you, Kimberly?
No. No.
Still nothing, Kimberly.
Yeah.
I've
Sure.
and I've unmuted everybody just to make sure your cell phone wasn't caught up in the mute.
I had a question.
Well,
And I know you're on Zoom 100 times a day. This is bizarre.
so are there, I spoke very fast, covered a lot of issues.
Maybe
Are
she
there
could go out and come back in.
I do have a question, but I'll wait.
Yeah, so Kimberly, that's a good idea. Can you log off and come back? There you go.
So while we're waiting for that, Matt, I
Go
just
ahead.
wanted to mention that I was involved working with the Bioethics Network with Ken Goodman at University of Miami, and we adapted some of that for Palm Beach County as a recommendation from our medical society. And I want to let you know we were highly sensitive to that possibility of discrimination towards people with disabilities, and the life expectation is just part of the equation. It also balanced out with life years. And the reason that we were modeling something that basically has been done in a number of other states is so that somebody, if it was in that situation in the ICU where you had limited access, limited availability, that it wouldn't be just an arbitrary decision by someone who was emotionally stressed at the last minute. And, the other options is like just first come, first served, or just random, or just pick numbers. So we tried to be extremely sensitive. And it also, that set of recommendations is a work in progress, so it's not a fixed thing. It's a living document.
it's a dilemma. It's without a doubt a dilemma. My overall concern from a social model of disability is any bioethics standard, when you are evaluating disability as a factor, devalues the disabled
You want to
life.
see what's
So
going on?
it's a very difficult issue to tackle from a disability standpoint. And then on top of that, you have recent guidance from the Office of Civil Rights that says that you can't take into account disability when you do that. So it puts you in a position about what is the best standard. Is a lottery the best standard? First come, first serve? Or how do you measure it? It's an incredibly difficult situation. But what makes it even more difficult is when you put it side by side with the Florida Hospital Association talking about qualified immunity. So does it give them a way to say, okay, we made this decision. It was a stressful situation. I relied on something, but it was a mistake to rely on it because we did have it. But again, it's a difficult balance, to say the least. But hopefully it's going to be moot. That's what I hope.
Exactly. So far in South Florida, we've said repeatedly, largely with the, even though you see exceptions on the news, there's been a lot of very, very responsible people following social distancing, et cetera. And that's allowed us to avoid some of the problems that they had, for instance, in New York City.
But on the other hand, with standards, I just got somebody calling me from a hospital in St. Petersburg who's deaf, who went in the hospital and was told that they can't bring in a live interpreter because it's not so.
So let's give Kimberly a try again. And see.
Yes.
Can you hear me now?
Yeah.
Oh, perfect.
Yes.
Okay. I missed some of what Matt said, so I don't know if I'm going to be going over some of the same things. But another issue, and I didn't hear you talk about it, was being able to take somebody in with you. As the mother of a young adult, but still young, with Asperger's, it was a huge fear for me when he was exposed to somebody and started to spike a fever himself. And it was at the very beginning, before anybody had any limitations on travel. I flew out there, but There is an effort, and did you mention this already, Matt?
I'm sorry?
Did
No,
you
I
already?
didn't at all. Nope.
Several of the professional medical organizations and dental organizations have issued a statement on this to allow individuals with communication disabilities, with a strong need, people who normally rely on somebody as a caregiver, to enable that person to have someone go into the hospitals with them and make an exception, taking precautions to keep that person safe and everybody safe. But there is, most of the medical associations who have addressed this have taken the position that individuals with disabilities should have somebody there to help them be able to navigate the system just like anybody who didn't have a disability would be able to. And then you already talked about the liability. You talked about a lot of the same issues, so I think we'll open up to questions.
So I'm going to unmute all. And ladies and gentlemen, if you're not going to ask a question, I'll ask if you could please mute your phones yourselves, or at least hold down on the background noise so that the question and the speaker can be heard. Here we go.
Questions? It's usually a very noisy group.
I'll ask another question. In terms of
Rebecca
disabilities.
had her hand up. She wants to.
Oh, I'm
That's
sorry.
okay. Oh, no, it's okay. That's okay.
You go ahead. You go ahead.
Okay. I was just going to ask, so this, when you talk people with disabilities, so this is developmental and physical, correct?
Correct.
Okay. And so who do you work for? What do you, sorry, I missed that.
I have a nonprofit legal advocacy center called Disability Independence Group. We're located in Miami.
Okay. Oh, so you're an attorney as well?
Correct.
Okay. That was my question. Okay. Okay. Thank you.
Sure.
Yes, I was curious in terms of the relationship between COVID and persons with disabilities. Are there different factors at play, those persons who have visible disabilities as opposed to those who have the invisible disabilities?
It's always an issue in church.
It would apply to a lot of folks that have immunocompromised states. So a lot of invisible disabilities, and folks with cerebral palsy and other physical disabilities as well. But I guess it depends upon each person.
It's my understanding that the guidelines were developed in order to prevent individuals, healthcare providers, from using implicit bias against individuals with disabilities and against individuals in general, people who might not have been able to pay or whatever.
Yeah.
The intent, I believe, was to protect individuals who might otherwise be discriminated against when making the healthcare decisions. And it doesn't entirely protect against that, but
It helps.
guidelines are more problematic for people who have, some people who may have medical conditions that are not apparent. You may not look at somebody and know that they have cancer if they haven't had chemo and lost their hair. And people with cancer are on the red flag kind of list of not as likely to get care from COVID.
It's sick.
You can't necessarily look at somebody who has heart disease and know that they do,
Right.
or diabetes. So some of those conditions that really put you at risk under the guidelines are not visible, but we're trying to protect against any, preconceived notions being made. It used to be that people with Down syndrome would only survive until age 20, but now they're making it well past middle age, and so assuming that they may not make it and, you know, negatively categorizing them is a problem.
Kind of shitty.
One of the conditions is also mild dementia is one of the issues that is taken into account in the factors in the bioethics standards. Are there any other questions?
I have a question, Matt. It's Nancy Gow. Why in these nursing homes or assisted living facilities, why that are lacking testing, why can they not send swabs and with an envelope and swab them and then mail the swab in for testing?
I don't know the exact mechanics of why they can't do it. They could also call a lab to have their staff and their residents tested as well. So it doesn't matter how or why they don't do it. To me, it's just the fact that they need to do it. And to me, that's the biggest problem. And if they don't do it, then the reason why we do want in-home testing is they can call up the local health department and have their parent, mother, sister, brother tested, or the individual themselves can get tested in a long-term care facility by the health department. One of my clients in Tamarack was told that in order to have her mother tested in hospice, she had to pick her up, take her in her car, and wait in line at the drive-through testing facility in order to get tested. And her mother that lived with dementia couldn't sit in a car for 2 hours if her life depended on it.
Which it might.
Thank you.
So are there any other questions? I know we're getting close to the hour, but because of technical difficulties, go ahead, Marion, I see you there.
Yeah, I had a couple of questions about the testing. It seems to me there are a lot of different tests out there. Are they all reliable and approved by some approval agency?
That's definitely not a question for me. Doctor?
No, it's for Dr. Schilling.
That's my question. Yeah,
Sorry
well,
about that.
the tests, the original ones everybody's going was the PCR that checks to see if you have viral particles present in your body to confirm that you have an infection. That's the most definitive one. And now they're coming out with antibody testing. So it's confusing. We could do a whole seminar just on the different types of testing. They have different values. You know, one of them is to decide to determine if you have active disease right now. Another one's to determine if you were exposed to it. Many of the tests are not approved. There's a problem. Okay.
And who is approving them? If I
FDA.
wanted to get a test, whose test should I look for?
Well, I would speak with your doctor and find out what they recommend, or you can go to the Medical Society website for Palm Beach County, where we have a complete listing of the different options that are available. Or you can go online to LabCorp, and for $119, which your insurance might reimburse some of that, they will send you a test in the mail, and you can do it all by yourself and send it back to them and get the results.
So, Brent,
Thank you. I also had a question about the antibody.
before you start, Marion,
I'm sorry, sure.
yeah, before you start, folks, we are at the hour, but I'm going to ask Kimberly, Brent, and Matt, if you don't mind, would you stay on for any follow-up questions? But I wanted to make sure the folks didn't feel just obligated to sit here because we're still going, and I promised to cut them off at an hour. But for those of you, everyone who joined, thank you so much for joining. And I'm sure you will go along with me in thanking Dr. Dietz, Matthew and Kimberly and Dr. Schillinger for a very informative discussion. We'll be back next Wednesday. We're going to talk about something that affects us long-term here and our financial well-being. And believe it or not, it really is the census. And the census is facing some challenges because of this pandemic as well. So I hope you'll join us at 6 o'clock next week. We'll have a medical update, and Rich Bartholomew will join us as well to talk about the impacts on the census. And for those of you who have questions or you want to hear the answers to Marion's question, please stay on. I'll let this go as long as you want to talk. For the rest of you, good evening.
Thank you.
Thank
Okay,
you.
what was the question again?
My question was for you, Dr. Schillinger. I wanted to ask about the antibodies. Has it been definitely proven that you can't get this again? I keep getting mixed stories about that.
Yeah, you get mixed stories because the answer is mixed. You know, we're still rather uncertain.
We don't know.
Yeah, it's hopefully at some time there'll be enough data so we can understand what it actually means. If the antibody test comes back positive, it means that you were pretty much exposed to the virus, but it doesn't necessarily mean that you have immunity to it. So this is one of the criticisms, that we're not at the point yet where we can say, oh, I had a positive test. In fact, one of the things that they're talking about is people having these immunization passports. You may have heard about that. And that's at some point, maybe to travel to another state or certainly to another country, you're going to have to present this along with your regular passport. But if it was just based on an antibody test, it may not really be a valid test. So good question. Hopefully that
Thank you.
And Brent, I think part of what I heard in Marion's question, and I'm probably wrong, but in the rush to respond to the crisis, there was a demand for testing, and we didn't have the capacity in the system. And so I think some of the officials started approving these tests before they were completely vetted, and we were getting so many false positives, false negatives. Not just the type of test, but just the fact that tests were coming on the market in response that weren't really up to the standard.
Thank you.
I have a question. Are the questions related purely to the subject tonight, or can they be related to what the healthcare committee is doing about the pandemic?
Let's give it a try and see what you have there, John.
Well, you know, I mean, I've been doing some talks, you know, for businesses and what they're going through, because if they don't get back to business and they don't get things going, there's problems. Then people aren't going to be able to afford to come back, or they're not going to be able to afford to bring them in. They're doing anything to educate businesses on what's available for them, and also what's life going to look like after this whole thing. When you come back to a business, it's going to be different than what it was. It's going to have to be rebuilt in many ways. And the other part is, you know that I have a passion for the other part about people being prepared. And this has really brought this to a crystal point, that we now realize this more than ever. Now that we're all isolated, we understand where we really should be and what should be happening. And to what extent, you know, will you maybe take this format, webinars and other things of this sort, to spread the word? Because right now, a lot of people that's all they're doing, is they're attending webinars, you know, they're not going out. So that's kind of the two areas.
So maybe Kimberly and Matt want to tackle some aspect of this. I know that a couple of weeks ago we had Congresswoman on to talk about the CARE Act, as well as the stimulus bill to help sustain the businesses. And obviously, for what we're doing, that had to be a high-level view of the impacts and the benefits. Maybe we could look at a more in-depth conversation from some business specialists talking about different aspects of our economy and how
we did that. We did this. I recently did a talk for the Vermont Medical Society, a webinar. We brought a CPA on board. We talked about all of the aspects of what you could get through the stimulus package. But there's even another layer of it, which is that there's even ways to use the law to get tax refunds to help build things that you need to have. And a lot of people don't understand that. And I realize that's not really the league's major focus, but that's what employs the people that the league is really representing. And so that's one part of it. And
Well, in that arena, back into the disability area, is it not the case that statistically most people with disabilities are more financially challenged than just say the average population? And are they not also in a bind that, you know, here with this crisis, if you don't have savings, you may be in a difficult position to hold yourself over, you know, paying somebody to deliver groceries, getting additional internet service so you can entertain yourself. And people with disabilities, particularly getting Social Security and other government subsidies, if they have savings, it actually disqualifies them for some of those programs. So how does that dilemma figure in?
well, I mean, that's all about.
No, I'm asking our guests.
Okay, fine.
That's an interesting issue. Now, I think that in view of the pandemic and the depression that may come after the pandemic, people with disabilities that have Social Security income may be better off than those that are unemployed.
Yes.
And that's something that I may see as time goes on. Yeah, there are limits to assets, but there are ways to go around it. For example, ABLE Act accounts, where a person with a disability can have assets of $15,000 per year up to $100,000 in a separate interest-bearing account that will be not included in their Medicare asset limit, which is a really good perk. So you don't have to get a special needs trust. So it's a way to put away money for a rainy day, and it's something that I always recommend. But I see more of the harm on folks that are going to be unemployed and will not be able to get a job. But the effect is going to be on persons with disabilities being more subject to employment discrimination because they're not going to be hired over a person that is able-bodied, and that's going to be part of the inherent discrimination. But hopefully, we're going to see an expansion of healthcare and no cuts to either Social Security payment or supplemental security income.
I would like to just interject one thing in here. I employed for 30 years an individual who was totally blind. She was my main voice between our office and the people that we served. And the internet was great and helped a bit, but it eventually put her out of business because the software that she learned to touch and to hear a person's words versus see them or commute them into words, it couldn't work in some of the new software systems. However, today with disabilities, there are new opportunities for people because the new wave is going to be that we're going to serve people from home. We're going to work from home. Probably 30% more people will work from home. And some of those people who have mobility issues, that's not going to be the issue. So maybe there's opportunities and maybe there's things for them to do.
John, there are huge opportunities. And now telecommuting is going to be the norm, which is something that's really going to help folks. Also, folks that are blind now, the screen readers are phenomenal. You hear mostly in the litigation about that, the folks that sue internet websites in order to be accessible. But a lot of the other issues are employment websites. And a lot of the coding now that's used for internal employee websites are accessible so blind people could use them with screen readers. So the internet is such a lifeline for folks with disabilities. It does help a lot. But I still think that traditional discrimination is still going to go on, and it's a good thing that there is a safety net, because still approximately 70% of persons with disabilities are unemployed or underemployed.
I'm going to add another issue which I've been hearing about, and that is the individuals who are vulnerable to this virus, who have diabetes and heart disease and that type of thing, and are hesitant to go back and possibly be exposed, but they will lose unemployment if their employer opens up and expects them to work, and it's too risky for them to do so.
I mean, I think what's very interesting today, the world is changing. And I know in my community where I live here in Boca, everybody fought using the internet. Now they can't fight it. Now they have to learn how to do it. And what we do and how we carry that forward. And I think, frankly, for the league, there are great opportunities for the league. You can reach more people doing this than you can with the individual meeting at a library. And you can tag your things on almost every type of meeting you have. So those are just my thoughts.
Great.
So let's see. Karen is still here, Rhonda and Eula and Rebecca and Marion. Any more questions for our speakers? I know we kept them overtime, and I know they've probably been working all day too, so we truly appreciate you spending after hours with us. But one last call for questions before we let them go.
Thank you, guys.
Thank you.
Thank you.
Yes.
It was a pleasure speaking to all of you.
Yes.
Thank you.
Thank you. It was very interesting. Thank you very much.
Thank you.
Thank you.
Be safe, everybody.